As a cardiologist, you don't need to be reminded of the pressures and responsibilities your vocation entails. Each and every day has you facing critical, real-time health issues, which necessitate quick yet calm decision-making on your part. These decisions often need to be made quite literally in a heartbeat. Patients rely on your judgment and experience, and this is how it should be. At Emerge, we provide real-time clinical decision support at the point of care. The ever-growing pressure on healthcare providers to accomplish more with less threatens to decrease the overall quality of care by increasing the number of patients who fall through the cracks of the system. We recognize that your time is valuable and that anything which is not a resource at your disposal often acts as a hindrance, draining your time and consuming your energies. A tale of two clinics illustrates the difference Emerge makes. Both of these cardiologists are experienced, dedicated, and respected. Both strive to best diagnose and treat each patient and adhere to the guidelines and constraints of the healthcare system. But all things are not equal. The doctor on the left, hindered by bureaucracy, ever-increasing workloads, and possibly by incomplete information, will have a higher percentage of misdiagnosed or undiagnosed patients and accomplish less in a given day than the doctor on the right. This doctor is burdened by the same systemic workload and restrictions as his colleague, yet misses less and accomplishes more in a given day. Emerge is what gives him this edge. We don't make any decisions or judgment calls on a doctor's behalf. What we do provide is greater efficiency and the added security of quality assurance. Let's examine how this is accomplished in practice. A patient arrives. The nurse or medical assistant will now bring up the patient's electronic medical record. The Emerge logo has now turned orange, indicating that we have recommendations for you. You can review this information prior to seeing the patient. The Emerge dashboard screen shows you our list of recommendations, which are based on the most up-to-date appropriate use criteria and guidelines. You can choose to either decline a recommended care path, approve it, or click on More to open a detailed overview of how we arrived at this recommendation. For example, this HFSCD recommendation is based upon the following guidelines listed under the Criteria tab. These are the guidelines which triggered the recommendation due to their correlation with your patient's data. You can view the relevant patient data under its corresponding tab. The Action tab will provide a detailed view of Emerge's recommended actions. And now, it is entirely your decision whether to approve, decline, or close the window. Any care path approved by you will be marked green. If you choose to decline, just specify a reason, and the rejected care path will turn red. When you are done with our list of recommendations, close the dashboard window and the order injection window opens, so you can easily select the tests you wish to order for your patient. Now, you're done. We will take over and automatically inject the orders into the EMR along with the relevant guidelines and the patient's condition. In doing so, Emerge creates a record of your high standards of care while saving you time, increasing your efficiency, and giving you the peace of mind that comes with a professional level of quality assurance which guarantees higher adherence to the appropriate use criteria. Caring for a patient's heart is your job. Having your back while you do so is ours. We look forward to working with you.